This is Jonathan Bush, the CEO, President, and Chairman, Grand Poobah, and perhaps
Class clown
of Athena Health.
That's correct.
Okay. Sitting down for a video interview. We usually do podcasts. We had some technical difficulties in that we couldn't get the room that we wanted, and other technical difficulties in that my camera was out of battery power, and I have to be here near a wall at an outlet. There it is. There's the wall. There's the outlet. The evidence right there. At HIMSS11 in Orlando, Florida. As you can tell, it's a beautiful 80-some degree day outside, and here we are.
Great day for an indoor boat show.
Great day for an indoor boat show, and it really is a boat show on the floor.
Unbelievable. Towers of power there.
Yeah, I hate going onto the floor.
EMC,
yeah,
very impressive.
I hate going on the show floor just for that reason. It's like, yeah, do you really get any business done on the show floor?
I have no idea. I mean, lots of people come through.
Yeah.
My sense is the majority of them are trying to sell me something. Which is nothing worse than bullshitting the bullshitter and then the bullshitter bullshitting you back and going around and around.
Yeah.
But every once in a while, the other thing that happens is we have lots and lots of clients now.
Yeah.
That are kind of HIMSS members. We didn't used to. We had very few. And now we've got, a couple hundred hospital systems.
Yeah.
And the CIOs come by and check in where everything's going fine. There's no real reason to go out and meet with them. We do performance reviews with the operating folks.
Yeah.
We don't really talk to the technology people. So there's a bit of an old home week thing that it's turning into for us.
Okay.
And then, yes, sure enough, prospects come by.
Yeah.
And every once in a while, the purpose, the stated intent, which is that we meet someone new, actually happens.
Yeah.
But it is a little bit like a solar eclipse.
Okay. All right, so I guess it's a good time to be in health IT.
Everyone says
that, but is there still
nothing worse than the government trying to help? It just couldn't be worse. Every once in a while, people feel the jolt of the energy and the excitement and Obama speeches and the dollars. And think, oh, easy dollars. But there's nothing worse than getting something in a place like that, because that's all going away. There'll be all kinds of unintended consequences of it. And then you need to have a sustainable business after.
Such as unintended consequences.
Oh, well, I don't think the Obama administration meant to see the number of primary care docs that were vertically integrated into hospitals double in less than 2 years, but they have. And so now these doctors are being ordered to order from one place, and that may or may not drive down the cost of care. A lot of hospitals are feeling the obligation to employ doctors that they wouldn't otherwise do, and that's never a recipe for teamwork. A lot of doctors are feeling the obligation to sell out when they wouldn't have otherwise done that. That's not a recipe for teamwork. I think that those lines have to be allowed to move more fluidly than is currently happening, but it'll come back once everybody goes and moves on to the next thing.
Well, when are the private payers going to get into the game, or are they going to get into the game?
They are in the game big style. I had no idea that they would actually. I didn't even know they were alive. They've been sort of neutered, just doing M&A and merging and driving up their margins without really getting involved.
Well, they're buying the analytics companies. They want the data.
Yeah, analytics, but to not do anything. They don't narrow their network. They don't throw anyone out. They don't. But what's happening now is they're watching these hospitals and doctors merge, and they're seeing, just around the corner, these integrated systems basically taking on the risk-bearing role that they're providing today, and that is waking them up. And so now they are becoming active players in the market. So the primary medium is pay-for-performance programs, basically saying, no. An ACO is an organization that gets bonuses for doing what we tell it to.
Okay, this is the
tension where the hospital says, no. An ACO is an organization that goes past the insurance company and gets risks from the employer.
Yeah, well, that's the thing.
Or the government.
Well, that's one thing that I'm confused about, and I think a lot of people are confused about. What the hell is an ACO? Does anybody know at this point?
It's another TLA. Do you know what TLA is?
Not really.
3-letter acronym.
Oh,
we have a lot of them.
Oh, yes, we do. We do. That's right.
But anyway, the idea of ACO is the same thing as any of these, capitated or risk-bearing. It's the idea of an IDN. It's an IDN. That was the last TLA to cover ACO. Yeah. But the government, the healthcare reform bill has specific provisions for ACO, accountable care organizations. Correct. Which basically are organizations that are delivering care in an integrated way. They are integrated delivery networks. And by applying to be if an IDN applies to be an ACO, then it can get more do-re-mi from the government.
Yes.
Theoretically.
Okay. So what has all of this done for Athena Health's business? I mean, the fact that you have all the data on the payers certainly helps sort things out and streamline and trying to figure out, how to be more efficient.
Well, I mean, there's goods and bads. The obvious good is that everyone's thinking about ambulatory healthcare. Thinking about doctors, they're thinking about practices, and that's our sweet spot. So there's nobody who's more accountable to doctors in the country than we are as a creator of technology. I'm sure of that. I don't think anybody would disagree with that. And so, we got that going for us, and with all the attention on doctors, we get a jolt of energy. Going against us, theoretically, potentially, is a movement away from fee-for-service. A lot of our revenues today are wired into fee-for-service, so if everybody went to a capitated model, our revenues would drop. Still we'd still be a great company.
But you'd adjust to that environment.
Our costs would drop too, and it's fine. We don't see that happening immediately. Instead, what we see is the big kind of fundamental underlying takeaway that I've been able to draw from all the toing and froing is clinical information has been inexorably added to the revenue cycle.
Yes.
So you now need to not just say what you did, but you need to say why, and you need to say if it's working in order to get paid. That sounds like a neat idea to me.
Yeah.
And so that works really well with our model of this cloud-based service, which goes out and learns all the rules and changes the software constantly to map to all the different rules for all the different payers for all the different disease states.
Okay.
So that's I'm hoping that particular good, yay outweighs all the boos that are happening.
Now, wouldn't fee-for-service, doesn't fee-for-service just sort of perpetuate the high-cost, inefficient system that we have now?
I don't think it has anything to do with the way you pay.
Every
different game is winnable by every different player.
Okay.
Totally.
Doesn't it encourage more use?
We saw with capitation,
more use
of
services?
That drive 1 million covered lives into a small place and try not to see them. And then they, make tons of money for doing the wrong thing. And then they end up with these highly invasive cases because the patients, didn't get treated for something they needed or whatever. I mean, there's all kinds of problems with all kinds of systems. I think what we need is more range of motion. So people should try more aggressive capitation, and they should try direct payment by employers, and they should try, these kinds of ACO bonus plans. Places with big balance sheets ought to take more risk, and take more responsibility. Places with smaller balance sheets ought to, seek places with big balance sheets to pay them bonuses for doing the right thing.
My personal pet peeve about this whole health reform thing is that the health reform that seems to be talked about most is health insurance reform. It's not health care reform. And I think there's a huge misunderstanding among the public that health insurance is not the same thing as health care.
Right. No, I don't think anybody in the current administration is saying that anything that's happened so far is going to make healthcare more affordable.
No.
I'm pretty sure everyone agrees that this is going to make it more expensive. I'm not sure about that, but I think, I mean, certainly in Massachusetts, which was the harbinger of this model, the cost went through the roof. So, I mean, 50% increase in the cost.
Well, you can't just throw more money at this.
What I hear the experts say is, but once we get everybody covered, then we'll feel better, and then we'll start working on costs. Okay? Great. I mean, whichever. It's not what I would do if I was a public servant, but I'm not. I'm a private public servant.
But you have Todd Park's cell phone number, I'm sure.
Yeah, but I try not to lobby family, and Todd's family in many ways.
Okay, so, but there are elements of reform that are in that Patient Protection Act that just aren't talked about, like, for example, the ACOs that we can debate whether that means the Center for Medicare and Medicaid Innovation is an element of reform.
That is the ultimate oxymoron of all time.
Okay.
Of the world. It's just fundamentally the DNA of Medicare and Medicaid is anti-innovation, and not in a bad way. The point of innovation is you take massive risks, and lots of people hate it, and every once in a while one of the wacky ideas becomes popular. But 90% of innovation attempts should fail, right?
But isn't that what we do? Isn't that
Medicare can't take itself and throw it against those kinds of things. No, that's why government should recede out of healthcare. But if it doesn't, it shouldn't innovate too quickly. I mean,
Okay.
it would be great.
Okay.
The risks are too high, and
Okay.
nobody should be mad at the government for not innovating fast enough. I mean, it's just
A big,
not something the government has ever done in
that's
any
right.
way ever.
It's a big bureaucracy, and it moves very slowly.
It has rules around fairness
Yeah.
and equity
Yeah.
and stability and security
Okay.
and privacy.
Yeah.
The number of mandates and boundaries
Yeah.
that the government has to operate within, and they have some very brilliant, very well-meaning, very charismatic, just incredible leaders. But anyway, it is the nature of this beast that it's not an emotive, creative, visionary, changing thing.
Okay.